Hello, it's Dr. Elisha Van Dusen at New Hope Chiropractic. How do you know if you have carpal tunnel syndrome? I get this question all the time in my practice. Well, carpal tunnel syndrome is very common. A lot of people have it these days, especially with all the computer work that we do at our desks for hours and hours and hours on end. And it affects about 3 to 6% of the general population. Up to 50% of those afflicted with it have it in both hands. So why is it so common? Well, here are several reasons. Anatomy, number one, the wrist is made up of 8 small carpal bones that allow the wrist to bend and twist in many different positions. And if you were to look at the wrist head on, you'd notice it's shaped like a tunnel where the 8 little carpal bones make up the roof, and basically ligaments and tendons on the other side, and their sheaths surround the nerves on the other side. So it forms a tunnel. And then you have 9 tendons and their sheaths that pass through the carpal tunnel, attached to the forearm muscles, to the fingers, on the palm, the side of the arm, blood vessels, and then the median nerve, which goes through there. And when there's less available space within the carpal tunnel, and that happens typically with inflamed tendons, the added pressure can compress the median nerve, and that results in numbness, tingling, and weakness, mostly into the second to the fourth fingers. So that's one reason. Jobs, like I mentioned before, is another reason. With occupations that require fast, repetitive movements and or firm grip with the wrist and the hand, they have a higher incidence of carpal tunnel syndrome. Also women, gender is another factor. Women have a greater risk of developing this than men due to smaller wrists, and also hormonal changes that can result in swelling of the wrist. And age is another factor. Individuals over age 50 have a much greater risk of developing it, especially females. And also general health issues too. There are a lot of different conditions that can cause or aggravate it. Some of these are things like rheumatoid arthritis, diabetes, osteoarthritis, low thyroid function, and cysts that occupy space in the carpal tunnel, which put more pressure on the nerves. Medications too, like birth control pills and some forms of chemotherapy. With cancer, they can also cause carpal tunnel. And a pinched nerve in the neck or shoulder can also alter the median nerve function, which can make it worse. So that's where chiropractic comes in. Trauma, that's another way you can develop carpal tunnel, especially falling on an outstretched arm. That can cause a sprain or fracture of the wrist. And if the fracture happens, onset of carpal tunnel can be very rapid, and it's important, of course, to get that fracture realigned as quickly as possible. So chiropractic care is a great way to treat carpal tunnel, and it gets pressure off the carpal tunnel by properly aligning not only the carpal bones in the wrist, but also the neck, addressing issues in the neck, bones in the neck, which can go out of alignment and put pressure on the nerves that travel down the arm. So if you have carpal tunnel or you know somebody who does, it'd be a great idea to get them checked chiropractically, and we can help with that. Just find us online at newhopechiropractic.com, book an appointment right on the website, and we'll be sure to help you as soon as we can. And with that, have a healthy day.